Okay, welcome back everybody. So let's cover the rest of the skull. So again, skull bones can be grouped into two general groups. So what we have are the cranial bones, protect the brain, and then you have your facial bones, and these protect the entrances to your body. So you have the things like here we have the eye sockets, the orbital complex that protects your eye. Here we have the nose and or the nasal cavity, and then you have bones protecting that. And you have your mouth, and you have these bones of your jaw that help to protect that. So what we have is the facial bones, and these are the facial bones. We'll list them. So you have the vomer, the conche, and I think it's pronounced concha by some people, but it's like conch shell, or like Spanish they say concha. It's sometimes called concha, but I say conche. All right, but the other thing is like I added this thing about inferior because why? Well, most people have three pairs of nasal conchae, and the superior and middle one, and the top and the middle one, is actually part of the ethmoid bone, but the inferior one is its own bone, so that pair of inferior nasal conchae. Then you have the nasal bone. So the nasal bone is right here, and nasal sounds like nose, and that's what it is. And then you have your maxilla, your mandible, your palatine, your zygomatic, and your lacrimal bones. And we'll walk through all of them. All right, so let's talk about this one now. This one, the vomer, is the hardest one to see in those pictures because if you look at the the front picture of the skull, I mean, it would be this tiny thing right in the middle of it, and it's hard to see it like deep inside that nasal cavity. So what we're looking at is the bottom of the skull right here, and the vomer is this little green colored bone right here. And if you take the vomer out and just have it by itself, it's a pretty narrow and skinny bone, and this vertical plate helps to make what is called the nasal septum, which divides your nasal cavity into a left and right portion. So with that, the vomer is in there. So I like to think, okay, if someone said, okay, what bone is this, and show me a picture. Well, if I say, okay, I think the vomer kind of looks like, at least from this perspective, like a little skinny V. And another mnemonic I heard is the vomer is very much in the middle. So that's where you also see the vomer. So you can see this in the real skull here. So it's down here on the kind of bottom of the nasal cavity. All right, okay, back to the ethmoid bone. So ethmoid bone, you have the superior nasal concha and the middle nasal concha. These are extensions of ethmoid bones, so they're not their own separate bones. So conchae, well, again, it's like concha, conchae, whatever, but it's like a shell, and that's literally what it means. It means this kind of like shell. So if you've ever seen one of the conch shells, it's shaped like that, and it's this complex structure to it, and spirals. That's another part of the structure. It doesn't look like a spiral in that picture, but trust me, it has this kind of spiral look. And sometimes they're also like called turbinates. And what they do, so here's the superior and middle one, and this is like if you cut someone's skull right here, and actually slightly offset from sagittal because otherwise you would just see all the bones that are in the midline. So it's like slightly off, so you don't see the bones that would be in the septum. But in this one, so what we see is that the superior and middle nasal conchae are actually part of the ethmoid bone. But this down here, this is the inferior nasal concha. And there's a pair of that left and right. And you notice that it's not part of the ethmoid bone. That's why it's considered pretty much its own bone. And then let's talk about the nasal bone. So your nose, you can feel your nose and the tip of your nose and all the sides of it. Well, your nose isn't a big old hole like this, right? Unless you get a lot of plastic surgery and you have a lot of nose jobs, your nose looks like your nose. But this nasal part right here, the bridge of your nose, it feels pretty bony. And you can feel this one right here. And like, why is the rest of your nose, if that part, only this part is bony, why are other parts of your nose kind of rigid? And that's because you have cartilage, or more specifically, hyaline cartilage that makes up where the rest of this nose would be. And then you also have like other tissue, you have also connective tissues and your skin surrounding those connective tissues to make up the rest of your nose. But again, your nasal bone isn't your entire no main point, your entire nose isn't just bone. You have like cartilage that you don't see here. But the nasal bone, that very top right there. Okay, and then let's move a little down into the sides, and what we have is the maxilla. So the maxilla makes up a big part of your face. It kind of makes up this part right here, and also your upper jaw as well. And the maxilla, below that, what we have here, the rest of your jaw. So the maxilla anchors your top set of teeth, but below that, you have your bottom set of teeth, and that would be anchored by your mandible. So the mandible is the one you open when you chew or speak or flap your gums or whatever. The mandible forms articulation with the temporal bone, but in terms of like your teeth, how to bring it together and chew something, that would be the maxilla, meaning the mandible. Okay, so then the lacrimal bone. So lacrimal is a term. So lacrimal, when you hear anything but lacrimal, it refers to tears. So lacrimal bone is involved with tears. And if you have your eye right here, and you would have your lacrimal gland that produces tears. And what it does is it produces tears and it follows this path. And then you have these ducts and sacs and things that collect excess tears and then drain it into your nose. So that's why if you have real crying, not the fake crying where like real crying is ugly. Like you're sobbing and then your tears are spilling down your face. And what also happens when you cry? When you cry, like this, your nose also runs because why? You're producing all these tears. It's draining into the your lacrimal ducts and sac, and then it goes into the lacrimal sulcus right here, or so this is again the sulcus is there to kind of carry something or make space for something, and then you have your nasal lacrimal canal, and that's why excess tears end up go draining to your nose. Okay, zygomatic bones. So if you have really nice cheekbone structures, you have very defined zygomatics. And here we are the zygomatic bones. So you have a pair of them. You have left and right just like your cheekbones. So if you have really prominent cheekbones, you have very prominent zygomatics. Or another mnemonic I heard is like when you say the word Z, it's kind of like you're smiling and then you're showing your cheekbones off. So that's like one way you can know it's like the zygomatics or your cheekbones. And then the palatine bone. Now, palatine bone is a little tricky because you might be okay. So feel on the top of your mouth, feel it with your tongue and towards the top, like toward the front, you notice that's very hard and bony. And if you move your tongue far back enough, it gets softer. Well, the bony part is called your bony palate, so that's the hard part. But the palatine bone is only a small part of it. Most of their palate, their hard palate, the bony palate, is your maxilla, as you can see here. So the palatine bone is like, well, there's another bone that makes up the bony palate. We already have the maxilla. Let's call it the palatine. So it's actually this very narrow bone right here. And here's another way you can look at it. So the palatine bone, again, we're looking at that hard roof of your mouth, the bony palate, and the maxilla makes up most of the surface. The palatine only makes up this fraction of the back part of it. So that's why it's a little tricky in terms of its name. It does it is this is part of the palate, but it's not the majority of the palate. The facial bones, what are they? You have the vomer, you have a pair of inferior nasal conchae, and again, the other nasal conchae are extensions of ethmoid bones, but for whatever reasons, they don't count the ethmoid bone as a facial bone in canonical lists. So nasal bone is like so you have two nasal bones actually, and even though it feels like one bridge, there's a pair of those. And then you have your maxilla, and there's sometimes okay, so then even though it looks like one bone and it kind of fuses like that, it's two bones and like depending on the source. But in terms of that, just know this is a maxilla if you're taking my class. And then mandible, that's your jawbone. And then you have your palatine bone, so there's a pair of that as well. And your zygomatic bones, that's what you have here. And your lacrimal. So your lacrimal, just like you have a left and right eye, you also have a left and right tear duct, and you also have these left and right lacrimal bones that help to support all the structures that help to carry away extra tears from your eye to your nasal cavity. So here's Vera and story time. So Vera, she has superpowers and she's saying, "Oh, superpowers are so easy. I can teach anyone to do that." But Vera, it's really hard to make a laser shoot out of your eyes. In fact, Vera cannot make my pupil zap lasers. So that is going to tell you the first letter of all of these over here. Okay, so after this, you should be able to locate, identify, and name the facial bones. I know there's additional markings, but maybe in an advanced class, they might ask you more about the specifics.